Welcome to the incredible and rewarding field of occupational therapy. You are about to embark on a journey where you will learn to help people overcome challenges and live their lives to the fullest. This profession is a unique blend of science, creativity, and compassion. You will become a problem solver, an advocate, and a source of hope for so many individuals. As you begin your studies, it can feel like there is a mountain of information to learn. Take a deep breath. Every expert was once a beginner, and this essay is your friendly guide to some of the most fundamental concepts in our practice: mobility, positioning, and the amazing tools that help our clients thrive. Think of yourself as a detective of daily living. Your job will be to investigate the barriers that prevent people from doing the things they want and need to do, which we call occupations. These can be as simple as brushing their teeth, or as complex as returning to a beloved hobby. A huge part of this work involves understanding how people move and interact with their environment. You will learn to see the world through a different lens, noticing how a high step, a narrow doorway, or a low chair can become a major obstacle for someone with physical limitations. This new perspective is one of the most powerful skills you will develop as an occupational therapist. One of the most hands-on and impactful areas you will explore is the world of mobility and adaptive equipment. This is where theory truly meets practice. You will not just be reading textbooks. You will be helping real people regain their independence and safety. Imagine the joy of a client who can finally cook a meal for their family again because you found the right walker and taught them how to use it safely in their kitchen. Let's start by defining our three key terms in simple language. First, think of mobility as a person's ability to move their body from one place to another. It is the action of getting around, walking across a room, getting out of a chair, moving from a bed to a wheelchair, reaching for an object on a high shelf, bending down to tie a shoe. In occupational therapy, we look at mobility as the key that unlocks a person's ability to participate in their daily life activities or occupations. Without mobility, even the simplest tasks can become impossible. Next, let's talk about positioning. Positioning is all about how a person's body is aligned and supported. Sitting, lying down, standing. Proper positioning is not just about being comfortable. It is a critical aspect of health and function. Are you slumped over? Or are you sitting upright with good support? Poor positioning over time can lead to serious problems like pain, breathing difficulties, skin breakdown, joint stiffness. Finally, we have adaptive equipment. This is any tool, device, or piece of equipment that helps a person perform a task they would otherwise have difficulty with. Think of these items as helpers that bridge the gap between a person's ability and the demands of an activity. Mobility is the very foundation of independence. Take a moment to think about your morning routine. Got out of bed, walked to the bathroom, used the toilet, washed your hands, went to the kitchen to make breakfast. Each one of those steps required mobility. For our clients, a loss of mobility due to injury, illness, age. As an OT, your role is to help them navigate these challenges. By improving a client's ability to move safely, you are not just helping them walk. You are giving them back the ability to care for themselves and engage in the life they want to lead. Beyond basic self-care, mobility is essential for social participation and mental well-being. Leave the house. Visit friends. Go to the grocery store. Attend a community event. When a person is confined to their home because they are afraid of falling, cannot navigate the stairs, it can lead to isolation, loneliness, depression. A client who can once again attend their grandchild's soccer game because you helped them master a cane or scooter is a powerful example of restoring mobility and connection. Proper positioning is one of the most important aspects of client care, yet it's sometimes overlooked. It is an active, not passive process. When a person has limited ability to move or shift their own weight, they become completely reliant on caregivers and proper supports. Think of a client who has had a stroke and is now using a wheelchair. Without correct support, they might lean or slump to one side. This poor posture, maintained for hours each day, can lead to a host of problems. Muscle shortening on one side of the body, overstretching on the other side, pain and permanent deformities over time. One of the most serious consequences of poor positioning is the development of pressure injuries. These occur when there is prolonged pressure on one area of the body, which cuts off blood supply to the skin, tailbone, hips, heels, elbows. For a client sitting in a wheelchair or lying in bed for long periods, constant pressure on these spots can cause the skin to break down. That can lead to painful open wounds that are difficult to heal and can lead to serious infections. A key OT role is to recommend appropriate cushions, mattresses, and to establish a schedule for changing position regularly to relieve pressure and prevent these devastating injuries. Beyond preventing physical harm, good positioning also enhances function and social engagement. Let's explore some of the common types of adaptive equipment you will encounter. We can group them by function. First up, ambulation aids, tools that help people walk. Cane, small support for balance. Walker, wider, more stable base. Standard walker you lift and move. Rolling walker, rollator, wheels, seat, brakes, for rest and mobility. Bathroom equipment, a common area for falls. Tub transfer bench, sits partly inside and partly outside the tub for safe sliding transfers. Shower chair, sit inside the shower to bathe safely. Grab bars provide sturdy handholds for entering, exiting the tub, or using the toilet. Dressing and grooming tools, simple but brilliant. Reacher or grabber, a long extension to pick up items without bending. Sock aid, holds a sock open so you can slide your foot in without bending. Long-handled shoe horn, guides the foot into a shoe. Finally, wheelchairs, a complex category. Manual wheelchair, basic, often temporary, requires propulsion. Power wheelchair, motorized for people without upper body strength. Power control, joystick, head switch, or sip and puff. The process of choosing the right equipment always begins with a thorough assessment. This is not about just grabbing a piece of equipment off the shelf. It is about being a good detective. The first step is to truly understand your client. What are their goals? What activities are important to them? What challenges are they facing? If a client's goal is to be independent with dressing, you need to observe them attempting the task. This observation allows you to see exactly where the breakdown occurs. Your assessment should include an evaluation of the client's physical and cognitive abilities. How strong are they? What is their range of motion like in their joints? Next, you must consider the environment where the equipment will be used. A piece of equipment that works perfectly in wide, open hallways might be completely useless in a client's small, cluttered apartment. You need to ask questions and assess the client in their own home. How wide are their doorways? After considering the person, task, and environment, you can begin to form a hypothesis about what equipment might help. The next step is to trial the equipment with the client. It is vital to provide clear instructions and allow the client to practice until they feel confident and can use the device safely. The best solution is always the one the client will actually use.